most Americans can still get a free COVID-19 vaccine, at least for now. Even as rules shift, the majority of Americans with health insurance remain entitled to receive COVID-19 vaccinations without paying anything out of pocket. That said, a few groups could soon face new costs. And this is where the situation starts to get complicated. Recently, the U.S. Centers for Disease Control and Prevention, CDC, formally approved a recommendation from its Vaccine Advisory Committee to move away from a blanket national endorsement for COVID-19 shots. Under this updated approach, vaccination is now considered a matter of shared clinical decision-making. In other words, people are encouraged to discuss the pros and cons with a healthcare provider who can guide them on whether the vaccine is appropriate for their individual health profile. However, it's important to note that this does not necessarily mean a prescription is required. But here's where it gets controversial. Some experts worry this technical change could make insurers less likely or able to cover the vaccine's full cost. Under the Affordable Care Act, ACA, private insurers are required to pay for vaccines that the CDC's Advisory Committee on Immunization Practices, ACIP, broadly recommends without charging patients. Similarly, Medicaid ties its own free vaccine coverage to ACIP's endorsement. Medicare, on the other hand, is governed by separate legislation that ensures COVID-19 shots remain fully covered regardless of the committee's decision. According to the U.S. Department of Health and Human Services, HHS, last month's CDC decision still supports immunization coverage through all payment mechanisms, meaning that programs like Medicaid, the Children's Health Insurance Program, CHIP, Medicare, and Affordable Care Act marketplace plans should continue to cover COVID-19 shots. But the reality might not be quite that straightforward. Amy Killalea, a researcher with Georgetown University's Center on Health Insurance Reforms, explains that insurers might interpret this shared decision-making category differently. Some may argue it's not the same as a full ACIP recommendation, creating a gray area over whether vaccines must remain free. This uncertainty, she says, injects ambiguity into what exactly insurers are legally obligated to cover. Private insurance plans fall under a patchwork of oversight. 3 federal departments, Health and Human Services, Labor, and Treasury, collectively regulate many plans, but have yet to issue specific guidance on the shared decision-making rule. Meanwhile, some state-level regulators have stepped in. At least 13 states now require insurers under their jurisdiction to maintain free COVID-19 vaccine coverage, according to KFF, a respected nonpartisan health policy foundation. Fortunately, most major insurers appear to be staying the course, at least for now. AHIP, formerly America's Health Insurance Plans, which represents companies covering over 200 million Americans, has said that coverage policies won't change through the end of 2026. Before the ACIP's September meeting, the group reaffirmed that all immunizations recommended as of September 1st, including the updated COVID-19 vaccines, would continue to be free to patients. Health plans are committed to maintaining and ensuring affordable access to vaccines, AHIP said, adding that its members base their policies on continuous scientific and clinical evaluations. United Healthcare, the country's largest insurer, echoed a similar stance. It has announced that COVID-19 vaccines recommended by ACIP as of January 1 will be fully covered in its standard commercial plans. However, those with certain job-based plans were advised to double-check with their employers. United Healthcare reiterated its commitment to keeping vaccines accessible and affordable, emphasizing that members should talk with their healthcare providers about what's best for them. The insurer also clarified that its approach will remain consistent with all federal and state laws, as well as recommendations from major medical organizations such as the American College of Obstetricians and Gynecologists, ACOG, the American Academy of Pediatrics, AAP, and the American Academy of Family Physicians, AAFP. Likewise, the tricky part, she said, is whether insurers will interpret a shared decision-making recommendation as legally equivalent to a full endorsement. For now, people enrolled in Medicaid can rest assured they'll still receive the shot for free, according to recent Centers for Medicare and Medicaid Services guidance. In a separate move, the CDC's advisory committee also voted to stop recommending the combined MMRV vaccine, the single shot that protects against measles, mumps, rubella, and varicella, chickenpox, for children under age 4. Instead, doctors will recommend the separate MMR and varicella vaccines. That shift means private insurers no longer have to cover the combined shot without cost. Parents who prefer that version might be forced to pay out of pocket. If manufacturers even keep making it, vaccine producers could halt production altogether, said Jen Cates of KFF. Similarly, the combined vaccine will not be automatically covered by Medicaid or CHIP, though states have the option to continue funding it. And in another decisive move, the CDC's committee chose not to include the MMRV vaccine in the free Vaccines for Children program, a decision that could hit lower-income families hardest. Still, the separate vaccines for measles, mumps, rubella, and chickenpox remain fully recommended and, importantly, will continue to be covered at no cost. So where does that leave us? In essence, the COVID-19 vaccine is still free for nearly all Americans, but the foundation of that guarantee feels a bit shakier than before. The question now is whether insurers and lawmakers will close the ambiguity before it turns into a real cost burden for patients. Should a preventive vaccine ever depend on your insurer's interpretation of one word? Recommendation? What do you think? Is this prudent flexibility or policy confusion waiting to happen?